Right now, nearly 4,000 children and teenagers are in foster care here in South Carolina, hundreds of them living in group homes, but those group homes have been receiving the same pay rate from the state for providing that care for nearly a decade.
State House reporter Mary Green explains why they fear not raising those rates soon could have long-lasting repercussions.
We've already seen, unfortunately, some of our providers go out of business. More and more of them will close if they don't get the rate increases that are long past due.
Kim Bowden works for the Palmetto Association for Children and Families, which represents 50 of the state's group homes, most of which are nonprofits. Their work providing care to hundreds of kids and teens in South Carolina's foster system has only gone up.
They've always been a vulnerable population, but I've been in the field myself for 35 years, and the needs are as high as they've ever been, and it's complex and challenging.
Group homes are also struggling with the same challenges many employers are now facing, like rising costs due to inflation and trouble finding workers. They receive money from the state, but the South Carolina Department of Social Services is asking for group homes to get an additional nearly $9 million in the next state budget.
Many of these group home providers, they have not had their rates adjusted since 2015. We were able to provide some one-time, kind of rate improvements because of COVID and federal dollars that were given to the agency.
DSS is also asking lawmakers for another $2 million to increase the reimbursements foster families receive each month by about $30.
We want to try to keep meeting the Southeastern average for the U.S. Department of Agriculture's guidelines and the cost of raising a child.
Bowden says these rate increases are critical. For years, she says many group homes have been relying on donations, grants, and endowments to offset the cost of services because the money they've been getting from the government hasn't been enough.
That's a risky business model, both for providers, but also more importantly for children and youth. It creates a lot of haves and have-nots, and that's not what the system wants. We want to be able to provide equal access to all children and youth.
Lawmakers will start taking up budget requests from DSS and other state agencies shortly after their legislative session begins here next month. Reporting from the State House, I'm Mary Green.